collect the information we had in last time about the gastric problems. So have I sent you the presentation about gastritis and stuff, how we should treat, or not yet? Because I don't remember.
No, you didn't send it.
Okay, okay, so I'll send those two presentations together then. Okay, so let's start our presentation about the anorexia and bulimia. So we today will discuss what type of nutrition and what type of management should we do in those people. But until I start, I have one question to you. So, have you ever met anybody with those types of problems who suffer from anorexia and bulimia?
No.
No, because this problem, I would say, is quite common, but unfortunately, nobody talks about that in society. So it depends on the country we live in, because there are some countries when, probably the developed countries, when the conversations and dialogues about this topic is okay, but in other countries who are not developed mentally, of course, there in these countries, this problem does not exist. But of course, it exists, but nobody talks about that. So what I try to tell you is that this pathology, which is absolutely psychiatric disorder, should be managed by dietitian or nutritionist very very carefully and gently, because as I said, this is mental disease, and this is not just nutrition which we should do here, but absolutely gentle mental care. So last time we had lecture about gastritis, and there the nutritional management is not that difficult, and gastroenterologist knows exact dietary plan, and exact food which should be forbidden and which should be banned. But here everything is different, and I will share my presentation just right on my screen. So until we start talking about anorexia and bulimia, so do you remember any important details which should be mentioned regarding the nutritional therapy in gastric problems? So, for example, do you remember? So I will, of course, send you the presentation, and you will read there better. But still, let me ask you if you remember about nutritional management in some gastric conditions. Anything which you kind of remembered from last Friday. So what food should be forbidden, and what food should be kind of banned from the dietary intake for the people who have gastric problems. So do you remember a little bit about that, or not really?
I think food with high
Mm-hmm.
fiber. Can't really remember. Yeah, like grains, fruits
So actually, probably depends,
for
yeah, on
gastritis.
which gastric problems. Oh, just one second. Well, so it probably probably depends on which gastric problems we are talking about. So of course, I agree with you. We have to give the patient high fiber products, which is lentils, which is vegetables and fruits in case of constipation. Yeah, but when the patient has gastric ulcer, so we said that the patient should treat himself or herself in very small portions, right? And the food should not be spicy and very salty and very sweet, and so we should ban alcohol and coffee as well. So this is very important when we talk about gastritis, because gastritis can actually transform into gastric ulcer and erosion and then ulcer. And gastric ulcer is very painful disease, which is even dangerous for, so it is life threatening disease sometimes, if it has complications like penetration, perforation, and internal bleeding. So that is why nutritional management of those people is very important. And in most countries, nutritional management in gastric problems are provided by gastroenterologist himself. So nutritionist does not really create and form that dietary plan for them. But when we talk about the people, which I will discuss in my presentation just right now, so when we talk about those people suffering from anorexia, here the psychiatrist and psychologist together work for the patient's mental background improvement, while we nutritionists, we work in order to create the relevant nutritional uh, dietary intake and plan for those people. This is not, by the way, not easy, because I will recommend you one movie which is about anorexic people. So the name for that of that is To the Bone, and the movie is about anorexic person girl who does not really eat anything. So the reason of that is not related to nutritional problems, but the reason of that is related to psychiatric problems, of course. And these people think that not eating is the correct thing to do in this life. And so, what I try to tell you is that we can very easily nutrite the people with gastritis, with any other disorders in GI tract. But regarding those people, everything is complicated, and we have to work very deeply, very, let's say, closely with the psychiatrist, and we cannot really prescribe any food without even asking the permission of psychiatrist. Okay, now let me share the screen and I will talk about this today. Oh, it is already shared. Mm. So it is visible, right? Oh,
Yes, I can see it.
okay. In this picture, we see two types of pathologies. First would be anorexia, and second would be bulimia. So the biggest difference between these two pathologies is nutritional and psychiatric problems. And the biggest difference still is that in first photo, picture, the person who suffers from anorexia actually suffers from weight loss as well. So that's a real patient who I'm not sure is alive or not really, because anorexia unfortunately leads to death very frequently. While bulimia nervosa in the second picture, of course, that's an actress, that's not a real patient. But let me tell you that this is really what happens to those people who suffer from bulimia. So they eat whatever they want to, everything is fine, but after some minutes, they go to toilet and they do what they do here. They just cause artificial vomiting, or they use some any other methods in order to waste out all the products they just ate. So that's the difference. Yeah, anorexic person does not eat at all, while bulimic person eats whatever she wants to, but then she goes to the toilet, and we said what she does there already. So in this picture, I'm really sorry to say, but in this picture we see two sisters, one of which actually died. I'm not sure right or left, but maybe even both. I'm not sure. They died because of anorexia nervosa, which they suffered from. So there were two models, two sisters, and of course, anorexia nervosa doesn't let you die instantly. But if you just continue your not eating lifestyle, of course, after maybe 6 months or 1 year or maybe two, everything uh, can discontinue with fatality in this case, and that what happened to that model who actually thought that not eating was the best thing she could do, but unfortunately, it was not right thing to do. Now let's talk about the causes of eating disorders. So we have four important reasons for that. One of them is personality problems. So I would say I would call it psychiatric problems. Then we have a genetical issue, genetical background, in which the people do not choose to not to eat, but it is their genetics which is doing that. So maybe genetical predisposition to psychiatric diseases or disorders. Then we talk about environmental influences, which I think is not really different from personality traits, because if you live in the environment and the area where everybody tells you not to eat too much, and only very fit women are beautiful and so on, of course this environmental mentality influences your mentality and brain as well, and after that you start believing that not eating is the correct thing to do. And biochemistry, which is that the person wants to eat and she tries to eat, but because of some biochemical problems the nutrients are not absorbed well, and unfortunately she suffers from this person suffers from nutritional deficiency. So probably you have noticed that I always say she in this case, because in 99% the people suffering from eating disorders are girls, young females. Regarding statistics, we see that over one half of teenage girls and one third of teenage boys use unhealthy weight control behaviors, which is vomiting and smoking or taking laxatives and skipping breakfast and fasting and so on. So again, I'm saying that it's not it's not even boys who are doing that, but most of the time it is girls. But I'm not sure, by the way, that it is one half of teenage girls. So I'm sure that these statistics are a little bit aggravating. I'm not sure, by the way, but this is what statistics give us. And so also some surveys have said that about 40% of very very young girls want to be thinner, and about 80% of 10 years old, which is again first or third grade boys and girls, are afraid of being fat. And so altogether, 10 million people have been diagnosed with having an eating disorder of some type, which can be binge eating, which can be bulimia or anorexia nervosa. So anorexia nervosa is characterized by very excessive weight loss. So it happens because of the girl decides not to eat, and that lasts for some months or some years. And of course, excessive weight loss is not surprising fact here. The patient is self-starving, which is very bad, and she is anxious about gaining weight and being fat, and she has denial of hunger. She may eat a little bit, but then she's doing excessive exercises in order to burn off the calories which she into just little bit, some hours prior. And that girl has withdrawal from some friends she used to be friends with, and she has very huge fear of weight gain and being fat. And unfortunately, those people have loss of menstrual periods in their puberty and post-puberty. And why? Because those people do not eat cholesterol at all, and cholesterol is, already is the source for some hormones, which can be testosterone or progesterone, vitamin D, and so on. So if they do not eat anything from that, what will happen? They will have problems with their menstrual cycle. What do counselors look for in this case when we talk about anorexia? So that would be rapid loss of weight, that would be change in eating habits, hair loss or dry skin, withdrawal from friends or social gatherings, and extreme concern about appearance or dieting. So if we doctors, doesn't matter it's me, nutritionist, or you rehabilitologist, if we see those those issues uh, in the patient, please be alert and very careful, because we may be talking here with anorexic patient. Bulimia nervosa would be same, a little bit same as binge eating, which is eating too much and then going, we already know where to induce artificial vomiting. So that would be recurrent inappropriate compensatory behavior in order to prevent weight gain, such as self-induced vomiting, misuse of laxatives or diuretics or enemas, which is also medication for um, uh, defecation, and other medications. Also, excessive exercise and fasting. So, unfortunately, self-esteem of both bulimic and anorexic person is very, very low, and is influenced by body shape and weight. So, symptoms of bulimic person looks like this. So one of the symptoms is eating very large portions of food, and then we already said using laxatives or eliminating food however they want to, and also excessive concern about body weight, irregular menstrual periods, and unusual dental problems, which is swollen cheeks and glands and heartburn or bloating. So just 1 second. So, warning signs that counselors should look for is evidence of binge eating, excessive rigid exercise regimen, unusual swelling of the cheeks and jaw area, knuckles from self-induced vomiting, and discoloration of teeth. The developmental level, regarding that, the I would say that average onset of bulimia, it comes in the second part of second decade, and that would be from 15, 16 to 20. And but of course there are lots of people in their 30s who also suffer from bulimia. So it actually it concerns 1 or 2% of young women, which is not that much, but still it's not little portion as well. 90% of those individuals are females. So I'm really surprised that 10% of those individuals are males, not less. I thought it was even less when I was doing this presentation. I was, surprised that only 90 and not more of individuals are females. Course may be chronic or intermittent, and unfortunately, this purging, this vomiting, and diarrhea itself becomes kind of as an addiction. So, what could be the health consequences of bulimia nervosa? So, unfortunately, it causes electrolyte imbalance, and which is loss of potassium and sodium. Also, unfortunately, it is inflammation and possible rupture of esophagus from frequent vomiting, and tooth decay and staining from stomach acids. And also, it is chronic irregular bowel movements and constipation as a result of overuse of laxatives. Of course, at first, laxatives work well, but then it can induce chronic constipation. Regarding onset and course of anorexia nervosa, is little bit, I would say it's not really different from bulimia. It again starts at the age of 16, 17, and most of the people are females. And in fact, about 1% of all females in their late adolescence, which is again not too much, but it still matters. It rarely occurs in females over age 40, and the course and outcome are highly variable. What could be the health consequences of anorexia nervosa? So it is abnormally slow heart rate, which we call bradycardia, and hypotension. Also reduction of bone density. Also muscle loss and weakness, with also severe dehydration. Why? Because they do not intake anything. Of course, dehydration will be there. At last, it can even result in kidney failure. Fainting, fatigue, and overall weakness, and dry hair and skin and hair loss is very, very common. So, what are personality problems in anorexia and bulimia? So, that would be low self esteem, that would be fear of becoming fat, and depressed, anxiety, and anger and loneliness that would be very associated with anorexia and bulimia. And they are perfectionists, which means that they want to fulfill their absolutely psychiatric abnormal aim to lose some weight, yeah, and they are very perfectionist over that, and they are very oriented to their achievements. Most of them are very nice students, by the way. What are some biochemical factors? Unfortunately, those people lack serotonin and norepinephrine, which are very, very decreased. And then we have chemical imbalance in neuroendocrine system as well, so which relates to control of hunger, appetite, digestion, sleep, heart, kidney functions, and so on. So of course they have those problems. And excessive levels of cortisol, which is same as stress hormone, is seen in anorexia, depression, and bulimia. Now, how should we assess eating disorders? Assessing eating disorders is not easy, but not difficult either, because actually there is no specific test to diagnose and no routine screening for eating disorders, and all we have is medical history, physical exam, and good history taking, yeah, and specific screening questions which should be asked by psychiatrists and nutritionists together to identify which eating disorder we have. So here you see some medical assessment, which is physical exam, which is heart and lungs, and we have to check weight, blood pressure, pulse, and temperature, which is checking tooth enamel and gums as well, which is checking lab tests and other diagnostic tests, the X-rays and blood tests, and the last but not least is history taking, a history of dieting by nutritionists, history of behaviors by psychologists or psychiatrists, and history of body weight by maybe endocrinologist. So, what would be treating strategies for eating disorder? Our subject nutrition is very important regarding treating strategies of those people. First of all, we have to hospitalize anorexic patient, and feeding plans are used for nutritional needs, and we use intravenous feeding because they do not eat, they just don't eat. If they eat, they probably will vomit because their stomach volume is very, very decreased, and that's why we have to do the intravenous feeding. We have to very, very deeply, very carefully monitor the weight gain, and it usually should be 1 kilogram per week, which is good, by the way. In the beginning, we give the patient 1500 kilocalories per day, but then we increase kilocalorie intake to 3000, 3500. And what about nutritional therapy? We have to educate not just the patient, but their parents and friends and partners as well. In bulimia, I would say that treating bulimia is much easier than treating anorexia, because these people, they do eat, but then they go to toilet for self-inducing vomit, but still they eat. That's the most important. The primary goal of bulimia is to cut down or eliminate binging or purging, or treatment involves psychological support, which deals with anxiety disorders, nutrition and counseling. Thus, so we should be here very actively involved. And we dietitians should help in meal planning strategies and medicational management, for which we use antidepressants. Not we, but psychiatrists. Yeah, nutritionists are not able to do that. And what about the nutritional counseling? Of course, in this case, nutritionists should be involved. In group therapy, we can also do the group therapy as well. Sometimes this group therapy helps a little bit more because it provides a kind of supporting network for those people. And prognosis for improvement. So it is very nice to hear that if we start nutritional therapy as soon as possible in anorexic and bulimic people, the outcomes are very nice. I would say 50% have good outcomes in bulimia and in anorexia as well. And the factors that predict good outcomes are early age and beginning treatment as soon as possible, and good relationships in family, and having healthy relationships with friends. So that would be our presentation for today. Any questions related to nutrition or anything?
Not really, but like I would like to know if there has ever been any case of a guy or a boy with anorexia, because like I've never heard of it before.
So, can you repeat the question?
Yeah, like, I would like to know if there has ever been any case of
Me,
a
if I
guy.
had, yeah.
Yeah, if
Yes,
you have. Okay.
yes. I have had. And actually, you know what? I just referred this patient to a special psychologist who works on those issues regarding the treating bulimia, regarding treating sleeping diseases. Actually, I sent her to this person, to my colleague, but then she never appeared back. So what I try to tell you is that when you catch this patient, you should not really send her anywhere, and you should just start nutritional therapy as soon as possible, which I did not. And so that was my mistake, because these people, they change their opinion regarding doctors. So one day they won't be treated, another day they don't. So that's why we are very gentle. And maybe if she comes back to me, I will continue nutritional therapy. Yeah, very small portions of tasty food should be prescribed to anorexic person. Actually, I have lots of even friends who have a mild version of anorexia, but they do not they refuse to admit this. But then there are a lot of people around me, not in clinic, but in just my life. So maybe you also have anyone who has sleep is this type of disorders, but they just don't confess, or maybe you don't know about them. So I have one bulimic person as well, and she confessed that she was purging every time she ate anything, she was just I was very surprised why she used toilets after every eating. I thought she had maybe diarrhea, so that's why I wasn't asking question. But indeed, she was just she had bulimia and she was inducing um, the vomit, which is very bad. And but as I said, the bulimic person is little bit um, better than anorexic because at least she eats a little bit, and in anorexia she doesn't really eat anything. So okay, any other concerns or questions? So again, as I said, but I will repeat that we're gonna finish our seminar course in nutrition after 2 weeks. Okay.
Okay.
So okay, I'll say goodbye to you this
So,
time, and next Friday we'll bye bye.
wait, the finals, is it going to be after the 2 weeks or?
Salome, which is your manager, she will let you know about this by mails because
Okay.
I'm not sure about dates. But all I can tell you is that your finals will be same as you had these two midterms, absolutely same.
Okay.
Mm-hmm. Bye bye.
All right. Bye.